Hi, my name is Chad Motter. I am a special education teacher at Sunflower Elementary in the Gardner-Edgerton School District. Today, I want to talk with you about epilepsy. Having a child with epilepsy in your classroom could present unique challenges. I would like to educate you on the disability and recommend ways to work with a student that has epilepsy. Epilepsy is an umbrella term used for a brain disorder that causes seizures. There are many different types of epilepsy. It encompasses over 40 different types of seizures. Epilepsy can happen at any age. Many children with epilepsy can outgrow the condition. Seizure symptoms can vary widely. Some people with epilepsy simply stare blankly for a few seconds during a seizure, while others repeatedly twitch their arms and legs. According to the latest estimates, about 1% of adults aged 18 years or older have active epilepsy. When applied to the 2013 population, this is about 2.4 million adults. According to the latest estimates, about 6/10 of children aged 0 to 17 years have active epilepsy. When applied to the 2013 population, this is about 460,000 children aged 0 to 17 years of age. The total indirect and direct cost of epilepsy in the United States is estimated to be $15.5 billion yearly. Seizures are caused by overexcited nerve cells in the brain that fire abnormally. In about half of cases, the case isn't known. Some things that can cause seizures include a head injury, genes, dementia, injury to a brain before birth, some medical conditions such as meningitis and lupus, stroke, and heart attacks. The four most common causes are brain infection, brain tumors, head trauma, and strokes. Research suggests that genetic abnormalities may be some of the most important factors contributing to epilepsy. Some types of epilepsy have been traced to an abnormality in a specific gene. Some researchers estimate more than 500 genes could play a role in this disorder. In 2 out of 3 people, the cause of epilepsy is unknown. This type of epilepsy is called cryptogenic or idiopathic. Epilepsy is diagnosed by meeting with your neurologist and undergoing a series of basic tests. The first step is to review your medical history, including a detailed recounting of the seizures with your physician. This physician will also conduct a thorough neurological examination. In most cases, an EEG, which is known as an electroencephalogram, and an MRI, magnetic resonance imaging test, will be performed as well. You will meet with the physician after these tests to discuss your results. There are 2 types of seizures, which include focal partial seizures and generalized seizures. We're going to look at the focal ones first. These seizures appear to result from abnormal activity in just one area of the brain. These types of seizures fall into two categories: focal seizures without loss of consciousness may alter emotions or change the way things look, smell, taste, feel, and/or sound. It may also result in the involuntary jerking of a body part that could include an arm and/or leg, and sensory symptoms such as tingling, dizziness, and flashing lights. Focal dyscognitive seizures involve a change or loss of consciousness or awareness. During this kind of seizure, you may stare into space and not respond normally to things within the environment. You could also perform repetitive movements that could include rubbing your hands, chewing, swallowing, and/or walking in circles. Generalized seizures appear to involve all areas of the brain. There are 6 types of generalized seizures. Absence seizures, previously known as petit mal seizures, often occur in children. They are characterized by staring, subtle body movements, such as eye blinking or lip smacking. These may occur in clusters and cause a brief loss of awareness. The second is tonic seizures. They cause stiffening of your muscles. These seizures usually affect muscles in your back, arms, and legs and may cause you to fall to the ground. Atonic seizures, which is the third one, are also known as drop seizures because of loss of muscle control, which may cause you to suddenly collapse or even fall down. The fourth one, clonic seizures, are associated with repeated or rhythmic jerking muscle movements. This type of seizure will usually affect the neck, arms, and face. Myoclonic seizures usually appear as a sudden brief jerks or twitches of your legs and arms. The sixth one, tonic-clonic seizures, previously known as grand mal seizures, are the most dramatic types of epileptic seizures and can cause a complete and abrupt loss of consciousness, body stiffening and shaking, and sometimes loss of bladder control and biting of the tongue. Treating epilepsy. Approximately 30 to 70% of people who have one seizure will have a second seizure within 1 year. The most common epilepsy therapy remains anti-seizure medications. There have been a variety of medications used over the past decade, and they still remain very effective for the majority of patients with epilepsy. Here recently, medications with better side effects and safer long-term records have been introduced. Seizures can also be treated surgically. Seizure surgery is most successful when physicians are able to localize the precise area in the brain where seizures originate. Physicians will use an EEG, which is known as electroencephalogram, to record the number of seizures, providing the best video and data possible for the surgery. The overriding treatment goal for individuals with epilepsy are as follows: maximize their independence, maximize their learning potential, provide a quality of life, enhance social and peer interactions, maximize lifestyles consistent with their capabilities, enhance psychosocial abilities through medication. Students with epilepsy and school performance. Seizures can result in missed information, particularly if the seizures are brief and not noticed by teachers. They can also disrupt memory function, so that the information provided prior to the seizure is not properly stored. Postictal effects. This period after the seizures can be associated with memory dysfunction, sleepiness, and confusion, all of which can interfere with learning. Interictal epileptiform discharges. This is abnormal electrical activity in the brain that takes place between seizures and can cause temporary changes in cognitive functions like alertness and processing speed. Structural brain abnormalities. The effects of the intractable epilepsy on a region of the brain called the hippocampus can result in problems with memory and other cognitive functions. In addition, the underlying structural abnormalities responsible for the epilepsy are often the primary cause of learning problems. Medication side effects. Any medication that has the potential for cognitive side effects. Such effects are more likely in children on high doses of multiple medications. Sleep disruption. Epilepsy and its treatment can interfere with sleep. Not getting enough high-quality sleep can have a major impact on cognitive function. Depression and anxiety. Both depression and anxiety disorders are more common in children with epilepsy than the general population. Both can affect concentration and other cognitive functions, and both can reduce the child's motivation and confidence in school. Integrating students that have epilepsy. Many children with epilepsy have normal intelligence. They perform well in school and can have a smooth transition into being an adult without any need of services through IDEA, which is the Individuals with Disabilities Education Act. Some children that have epilepsy can have other disabilities in conjunction with epilepsy that can intervene with school performance, such as intellectual disability or brain injury, autism, or learning disabilities. Students with epilepsy may or may not have an individual education plan, which is an IEP, or 504 plan, which will have detailed information on the student's diagnosis. The IEP is developed by a special education teacher, a general education teacher, parents, therapists, if needed, and other people that may have knowledge of the student. The IEP should include information about the student's performance levels in various subjects. This will also detail their ability to function at, above, or below grade level. Goals and objectives are created to fill in the gaps that the student may have in his or her learning. Students that are on an IEP and are placed in the general education classroom is considered to be LRE, which stands for the least restrictive environment. If the students are placed in a specialized location for teaching, this is considered the most restrictive environment. Depending on what the underlying issue is with the student, depends on where and how the student is educated. We always want to strive for the least restrictive environment. If there is a plan in place for the student, whether that is an IEP or a 504 plan, it is very important for the student's classroom and any of the other teachers that work with him or her to understand the student's progress and what his or her abilities are like. Accommodations for students with epilepsy in the classroom. Students with epilepsy may demonstrate academic challenges in reading, writing, and/or mathematics. Students may have difficulties due to memory and attention deficits, epilepsy medication side effects, general slowed cognitive functioning, and/or absenteeism. A quick overview of some of the accommodations that might be useful for students with epilepsy. Keep instructions simple. Do not include irrelevant or unrelated information in your teaching and/or directions. Provide instruction at an appropriate pace. Provide instruction in multiple formats, such as auditory, visual, and/or kinesthetic. Use graphic organizers when writing to collect your thoughts first and then put them on paper. Use graphic organizers when reading to collect and organize your thoughts that you have just read. A quick overview of some of the accommodations that might be useful during assessments for students with epilepsy. Many students with epilepsy have difficulty with declarative memory. This is the memory for specific facts. Students with epilepsy may have difficulty taking tests that assess recognition rather than recall. An example of this would be multiple choice rather than fill in the blank, or tests that assess broad understanding instead of knowledge or specific facts may provide a more accurate representation of the overall understanding on the subject. They may also benefit from breaking larger tests into smaller parts to be administered over several sessions to avoid fatigue. When this is done, test scores should increase because the student is not as fatigued as normal. Students should also have the ability for flexible timing, such as what part of the day or on different days altogether, especially if the seizure has already happened that day. When a student has a seizure, that student could potentially be very tired for the rest of the day, or they may not be able to access the knowledge for that test. Allowing the student to be tested in a different setting, such as a different room, whether it be the special education room or just another room in the school, that might be more quiet and less distractible.